Hello and welcome. If you thought medicine was difficult, wait till I introduce ophthalmology to you guys. I have a collection of psychotic images that we have to go through because these are extremely high yield topic for exams. So the first image is a flower petaloid appearance on the FFA, and that is because of cystoid macular edema. Cystoid macular edema is fluid collection in the outer plexiform Hensley layer and the inner nuclear layer because there is a breakdown of blood retinal barrier. So this occurs most commonly after a cataract surgery, and there is a specific name for this cystoid macular edema that occurs after a cataract surgery, which is called Irving gas syndrome. Other causes would be prostaglandin analog use, diabetes, niacin toxicity, being aphakic, okay? And what you see on fundoscopy is a honeycomb appearance, and what you see on FFA is a flower petaloid or a flower petal appearance. And the reason you see this flower petal appearance is because the dye leaks from the perifoveal capillaries radially. So that is why a flower pattern is seen on FFA. Now, if you see the OCT image, then you will see these spaces. So there is thickening of the retinal layer and you will see spaces, okay? Spaces, not a break in the retina, but spaces, and that is specific to cystoid macular edema. Again, cystoid macular edema is a fluid collection in the outer plexiform Hensley layer and the inner nuclear layer due to the breakdown of blood retinal barrier. If cystoid macular edema occurs after cataract surgery, it is called Irving gas syndrome. On the fundoscopy, you will see a honeycomb pattern, and on FFA, you will see flower petal pattern, okay? Flower petal pattern you will see. On the OCT, you will see these spaces, okay? On OCT, there are multiple intraretinal cystic spaces. You will see spaces, okay? And treatment is you give topical steroids, obviously, or you give topical NSAIDs because they stop the prostaglandin, because prostaglandin use is associated with CME. So you give topical NSAIDs like ketorolac, which inhibits prostaglandin, and then this gets treated. Anyway, the thing is, when they give you an OCT image and they show you these spaces, not a complete break, because if it is a complete break, then you will see what's the diagnosis. But if you see spaces, it is cystoid macular edema. Understood? And if you have an OCT image and you see a big break, like you see over here, there is a break in the thickness of the retina, then this is your macular hole. That makes things easy for us. Hole. If you see a hole, it's macular hole. So there is a full thickness defect in the fovea due to the vitreomacular traction. Now, this is seen in an elderly patient or a trauma patient. Sometimes it can be idiopathic. The most important thing to remember is there is a full thickness gap. You can see there is a hole. Okay, there is a full thickness gap. Okay, and there is loss of foveal count. So you have a punch out defect. Now, if you see in the symptoms that there is a central scotoma, because macula is involved, so of course think of scotomas. You see ampular grid distortions, of course, again, macula is involved, so ampular grid distortion, you have reduced vision, and then they give you an OCT image of a hole, a literal hole in the retina, then that is macular hole. Okay, now, if you see cyst, again, I keep harping on this, but if you see spaces or cysts in the OCT image in the retina, then that is cystoid macular edema. If you see a complete hole, it is macular hole. And now we have this mushroom or smokestack pattern. So as a reference, smokestack being this. I thought of putting a atomic bomb going off, but I thought that would be too much for this video. So factory smoke coming out, the smokestack pattern, which you can see over here. Again, this is FFA images, okay? Or you see a cute little mushroom. So if you see a smokestack pattern like you see here, or you see a mushroom pattern, then that is your central serous retinopathy. And central serous retinopathy is where you have serous detachment of the neurosensory retina because you have a retinal pigment epithelium leakage. Okay, so if you have a serous detachment of the neurosensory retina due to a retinal pigment epithelium, then that is central serous retinopathy, which is seen in a young male or steroid use or stress. So you will see this dome shape elevation, okay, a dome shape elevation. You see a dome shape elevation on the or smokestack pattern as they describe it. If you see a smokestack pattern, which for reference image, this image, okay, it looks like a smokestack, or you see a mushroom pattern, okay, so that is your central serous retinopathy, right? Now, it will also show a ink blot pattern, okay, on the FFA, or a smokestack pattern, or this mushroom pattern. And That's your central serous retinopathy. So if you see a young stressed male and then they give you this FFA image, think of central serous retinopathy. Now, finally, we have another option that they might give you to distract you, which is age-related macular degeneration. So now this is age-related, it's in the name, it is more common in elderly, more than 50 years old. There are two types, you have a wet and you have a dry. The dry one has drusense, okay, and drusense is also a hallmark. Drusense is also a hallmark of age-related macular degeneration. And drusense are yellow deposits, okay, and if you have a dry, you will see drusense and you will see retinal pigment epithelium irregularities. Now, if you see this starry sky appearance, okay, which is like over here, you see it, right? Oh, before I go into that, I want to say that drusense are the hallmark for a dry, but then as the disease progresses, you can also see choroidal neovascularization, which is a hallmark. If you see choroidal neovascularization, think of age-related macular degeneration, okay? Because age-related macular degeneration is, of course, age-related, so it's senile, it's macular degeneration, it is chronic, and it's progressive. So not only do you have bilateral degenerative disorder, but it progresses. So it would start as dry ARMD, where you would have the presence of drusense, but gradually it's going to progress to wet, where you have choroidal neovascularization, along with geographic atrophy. But the thing is that drusense are extracellular eosinophilic deposits between retinal pigment epithelium and the Bruch's membrane. So drusense is between retinal pigment epithelium and Bruch's membrane. And on the FFA, you will see stars and sky appearance. So can you see the stars in the sky? This reference image, and then you look at this FFA image, and yes, it does feel like there is stars and sky appearance resemblance, and that is your presence of drusense. So if you see drusense, age-related macular degeneration, okay, and if you see over here in the fundoscopy image, then you will see drusense, which are like this yellow little spots. So either they give you this image or they give you this image. This is called your stars and sky appearance. The reference is right over here, and that is age-related macular degeneration. So this brings us to the end of our psychotic image memorization. Have a nice day, guys. See you in the next video.